The mysteries of the modern world are not only confined to murder cases or grand conspiracies. Sometimes, strange accidents hold shocking and haunting stories. On the journey to uncover the truth, we will delve into the story of a mysterious nuclear accident, a horrifying disaster that shook an entire nation and left a profound mark in history. Warning: this video contains graphic language. Viewer discretion is advised. On September 30th, 1999, Tokyo Hospital received an urgent notification that they were preparing to receive a patient named Hisashi Ouchi, who had suffered a workplace accident. However, this was no ordinary accident because Ouchi had been exposed to radiation. Upon admission, he was immediately transferred to the ICU for specialized treatment and to prevent radiation effects on those around him. After preliminary checks, everyone was stunned by the amount of radiation Ouchi had absorbed. In fact, a normal person would die instantly upon absorbing 5,000 MSV, and the allowable radiation dose is only 20 MSV. However, Ouchi had absorbed about 17,000 MSV, 3 times the prescribed limit. Yet, miraculously, Ouchi did not die immediately. Upon admission, he seemed perfectly normal. Observing physicians noted Ouchi's reddened body, as if sunburned, and swollen limbs. Was Hisashi Ouchi destined to become a superhero with seemingly harmless symptoms? At one point, nurses thought he would be discharged on the same day. However, those thoughts were immediately extinguished when the results of a comprehensive body examination were completed the next day. Our bodies are composed of many cells, each with specific functions. When the body operates normally, cells grow, age, and are replaced. To do this, the body needs chromosomes or DNA to provide information and generate new cells. These chromosomes can be easily identified because we do not have too many types of chromosomes. However, Ouchi's chromosomes could not be identified because they had been completely altered by radiation. Moreover, his DNA had been so severely damaged by radiation that its entire functionality had become useless. The only thing keeping Ouchi's body alive was pre-existing chromosomes, DNA, and cells. Therefore, when the backup chromosomes ran out, Ouchi's true nightmare began. In addition to the above results, Ouchi's blood showed that the white blood cell count in his body had dropped below 10% of the permissible level. This made his body extremely sensitive, very susceptible to bacteria and viruses from the surrounding environment. Therefore, he was quickly transferred to the sterile room for easier treatment. After days of monitoring and discussion, the one tasked with saving Ouchi's life was Dr. Maekawa. To do so, the doctor needed to find a way for Ouchi's body to create new cells because every part of his body, from the smallest to the largest, had been destroyed. The only way they could save him was to create an entirely new body. So, doctors had to try every possible method, including untested ones. After discussing with colleagues, Dr. Maekawa decided to try an experimental treatment method, which was stem cell transplantation. Basically, this was a process of taking stem cells from another person's body and transplanting them into the patient's body through the bloodstream. These cells would go straight into the bone, then gradually progress to the marrow and replace damaged cells. This would help the marrow recover and begin to produce healthier cells. Of course, the donor had to be compatible with the patient, and luckily, the person compatible with Ouchi was his sister. With the goal of creating a new cell system for Ouchi, doctors took about 160 milliliters of stem cells from his sister in 4.5 hours. After successfully transferring the stem cells to Ouchi, everyone had to wait and see if this therapy would succeed. Since being admitted to the hospital, Ouchi has been constantly struggling with shortness of breath, dehydration, and thirst. A week after the accident, his skin began to deteriorate severely. Every time a nurse changed bandages or administered injections, large patches of his skin peeled off. Even wiping his feet would cause his skin to slough off. Ouchi's body systems were not functioning properly, with no new cells to replace the damaged ones, so over time, his entire body's skin began to self-destruct and peel off to the deepest layers. Fortunately, this did not happen too often, causing bleeding wounds, as his platelet count was too low. Even a small wound would cause Ouchi to lose a significant amount of blood because it couldn't clot. Furthermore, after using X-rays to observe Ouchi's lungs, doctors discovered a tumor or some kind of compound pressing heavily on his lungs, making it difficult for him to breathe. Typically, doctors could inject and aspirate this substance to help the patient breathe more easily, but they were afraid of causing harm to Ouchi. Therefore, they completely ruled out this option. However, as Ouchi's condition worsened day by day, doctors had to opt for another approach, implanting a machine into Ouchi's lungs to assist his breathing. This machine would push oxygen into Ouchi's body and then extract CO2 from his body. However, this also caused intense pain whenever Ouchi breathed on his own. Additionally, he constantly had to endure the pressure generated by the machine's suction and pumping. Because breathing is a natural process for any living body, this breathing machine was essentially tearing apart Aoki's body every second. Every time the machine pumped oxygen in, his lungs swelled as if about to burst. When the machine sucked out CO2, his body and organs experienced excruciating pain. Initially, Hisashi Ouchi cried out desperately, pleading with doctors to remove the machine and even attempting to remove it himself. However, knowing that this was the only way to survive and to be able to return to his wife and child, he decided to endure. One might wonder why doctors didn't use sedatives, anesthetics, or painkillers for Hisashi Ouchi, but it should be considered that the amount of blood in his body was not enough to sustain the effects of sedatives. Administering sedatives would have been ineffective. With the situation worsening day by day, doctors advised Hisashi's family to prepare for the worst-case scenario, encouraging them to offer comfort and visit him more often. Radiation had changed his appearance every day, while Ouchi was battling with death. His family was always in distress. His mother, sister, and father cried a lot, feeling utterly dejected. His wife was the same, but she only dared to cry alone, knowing she was his last refuge. She encouraged him, telling him he was handsome, brave, and would soon recover. However, due to the damage caused by the machine and the intense pain it inflicted, he decided to have a tracheostomy tube directly inserted into his lungs. On October 10th, Hisashi Ouchi mustered all his strength to speak and have a final conversation with his family to ease their minds. Dr. Miyakawa repainted the entire waiting room to create a happier space and refurbished the patient's family's sleeping area. Additionally, Dr. Miyakawa personally informed Hisashi Ouchi's family of his condition to reassure them and encourage them not to lose hope. Indeed, they did not give up. Whenever Aoki's family waited, they folded paper cranes, believing that if they folded 1,000 cranes, the person they were thinking of would recover quickly. Perhaps that had some effect when doctors found that Aoki's body had improved significantly. Since Hisashi Ouchi's stem cell infusion, doctors have spent every day, every minute monitoring his body's indicators. After a week of infusion, Aoki's stem cells began to react. His white blood cell count had increased from 100 to 8,000, and the percentage of lymphocytes had increased from 1.9% to 20%. This indicated that the peripheral stem cell transplantation method had indeed succeeded, enabling Hisashi Ouchi's body to start building a completely new immune system. This event marked a significant milestone in medical history as Hisashi Ouchi became the first man to survive radiation-induced illness. Doctors, during this time, frequently monitored his indicators to ensure his body could still function normally. They focused on the immune system, which provided fuel for Aoki's body. After a few days of improvement, the supervisor noticed that Hisashi Ouchi's stem cell index showed signs of decline due to radiation damage. This shocked the scientific community because such a case had never occurred. Theoretically, there must be a radiation source penetrating the body for new stem cells to be damaged. Scientists hypothesized that Aoki's body had absorbed too much radiation, turning it into a new radiation source. Therefore, when stem cells were transfused, they were destroyed by the radiation already present in his body. Because of prolonged radiation exposure, Aoki's body began to show clear signs of decay. Every part, every organ in his body began to rupture and lose function. His skin began to peel off, but Hisashi Ouchi's brain continued to function normally. This means that his pain perception organs were still functioning. In addition to the skin shedding, breathing also caused him immense pain. Although doctors administered many sedatives and painkillers, they were unsure if they were effective since Ouchi couldn't speak. Worse, whenever anyone touched him, he felt bone-deep pain. So, every moment he breathed was hell for him. On October 26th, Aoki's body showed a strange symptom of passing water, even though doctors hadn't fed him anything. People thought that some compound in his body had come out through the anus. Doctors believed this case had two possibilities. First, this was a normal manifestation of radiation exposure. What's worrying the doctors is the possibility that this is the second scenario, where Aoki's own body might be rejecting the transplanted cells. Given that Aoki's body no longer has any organs capable of fighting off the implanted cells, it's entirely possible that his own cells could be attacking his body. Immediately, doctors had to perform an endoscopy of Aoki's stomach to ensure that this wasn't a reaction to the transplantation. Luckily, after examination, they realized that this wasn't the issue they feared. Instead, they found that Aoki's stomach was completely empty, with the mucus lining gone. This once again confirmed that Aoki's digestive system was officially non-functional. Just 2 days after Aoki's body started experiencing more severe changes, all the top experts in Tokyo's medical field converged on the hospital to find the most appropriate solution to save him. At this point, a new issue arose. Because Aoki's body had started to decompose, the myoglobin concentration in his body had risen. This phenomenon is called crush syndrome, which typically occurs in severe accident cases or major disasters like earthquakes, where a part of the body is crushed. Even if these patients are saved, they still die after a few days due to elevated myoglobin levels causing kidney failure. Aoki's myoglobin concentration at this point was 1,800 nanograms per liter, while the allowable concentration is only 60 nanograms per liter. Experts believe that during the accident, Aoki's right arm had the most contact with the source of radiation. Therefore, his right arm had been exposed to radiation and decayed to the point where the muscles inside had begun to liquefy. This part of his arm continued to contribute to the decomposition of his body in the days that followed. The tissues inside Aoki's body had started to melt, causing his body to experience diarrhea every day and expel at least 3 liters of waste, mostly from dead and decaying tissues. Additionally, with the increasing amount of waste, Aoki's body had to create more sites to expel the internal mucus. As a result, the swollen areas of his body also began to pus and push out this mucus. This phenomenon occurred not only because his body was liquefying but also because doctors had to continuously pump nutrients and related compounds to keep him alive. However, this action made his fragile body almost on the brink of exploding. The swollen areas also caused Aoki to bleed, so doctors had to keep his body from falling apart by wrapping his entire body with bandages and gauze. Since Aoki had many damaged areas of skin, this bandage layer became his new skin. However, because his body continued to ooze mucus and bleed, every 3 hours a team of 10 nurses had to replace the bandages. This was not an easy task because the skin helps retain body heat. Changing bandages could cause him to die from heat loss. For this reason, Aoki's treatment room was kept at 30 degrees Celsius, making all 10 nurses work in a sweaty state. Furthermore, because Aoki's skin was extremely sensitive, nurses had to be careful when wrapping the bandage to avoid wrapping too tightly, which could damage internal organs. Doctors also had to weigh the gauze replaced daily to measure the amount of waste absorbed into the gauze. On average, his body expelled about 1 liter of mucus through the skin every day. However, this condition not only did not improve but also made it worse, as the amount of mucus continued to flow out, causing his eyes to become drainage tubes for mucus. To improve this condition, doctors decided to transplant skin from Aoki's sister. However, taking skin from Aoki's sister and culturing it to grow would take an additional 4 weeks, during which Aoki's life depended entirely on fate. Fortunately, or unfortunately, Hisashi Ouchi is still alive. Doctors also quickly transplanted his sister's skin onto his body, showing that while his lymphatic and immune systems were useless, the outer skin could still be restored by skin grafting. However, this method was only effective until mid-November. Aoki's body began to lose more than 2 liters of blood per day through the skin, forcing doctors to perform skin grafts from organ donors, although not entirely suitable. Without this intervention, the hospital would not have enough blood for Aoki. Additionally, skin grafts help minimize blood loss and increase the ability to produce new skin for Aoki's body. On November 18th, 50 days after the accident, doctors performed a skin graft surgery. They removed the old skin and applied temporary skin grafts. Although initially Aoki's body didn't react well to this method, it proved to be more effective than using adhesive bandages. Therefore, doctors decided to continue this treatment. On the same day, Aoki's stool had turned completely into blood, causing great concern for the doctors. They urgently conducted an endoscopy and found Aoki's liver completely filled with blood. Since the body still needed to remove waste, Aoki continued to lose about 800 milliliters of blood per day. During the endoscopy, digestive specialists noticed some white areas in Aoki's stomach, indicating new mucosa had grown. This opened up hope for Aoki's survival. Despite facing immense challenges and suffering, Aoki still had a chance to live, so he continued to endure treatment. However, the next day, a much larger amount of blood, up to 10 liters per day, began to flow from his body. The only recourse the doctors could think of was continuous blood transfusions. Throughout this process, Aoki remained conscious, feeling the pain in every part of his body gradually decomposing and oozing out. With daily blood transfusions, Aoki's condition led to macrophage activation syndrome, causing his own immune cells to start attacking his blood. This necessitated Ouchi to receive additional serum at a much higher level than a normal patient. After 3 days of intensive blood transfusion, Ouchi went into shock but was fortunately saved by a large dose of epinephrine. From then on, all of Aoki's bodily functions were supported by machines. After witnessing all of these events, on December 19th, Dr. Maikawa decided that if Aoki's heart stopped beating again, they would let him go peacefully. After hours of explaining Aoki's condition to his family, Dr. Maikawa comforted them and encouraged them to let him rest. 2 days later, despite their best efforts, Aoki's heart stopped beating on February 21st. He had lived for 83 days with radiation exposure 3 times the allowable limit. Hisashi Ouchi's tragic death was a great loss to his family, and we can only imagine the physical and mental pain he endured during those 83 days. What led to such a tragic outcome? Hisashi Ouchi was a technician at the JCO fuel conversion plant in Tokemura, supplying nuclear fuel to other power plants. On September 30, 1999, Ouchi and his colleagues, Yutaka Yakakawa and Masato Shinohara, went to work as usual. However, facing a 2-day delay in delivery, the company pressured the technicians to fulfill the order ahead of schedule. Fearing job loss, Ouchi and his colleagues adjusted and shortened the process to meet the deadline, unaware of the inherent risks. At 10:35 a.m., a blue flash appeared in the production area, triggering a radiation alarm. Radiation leaked from the mixing tank, instantly killing Yakakawa. Ouchi and Shinohara ran to a nearby changing room, but it was too late. Both felt extreme pain, nausea, and difficulty breathing. They were promptly taken to the University of Tokyo Hospital, but only Ouchi survived. Ouchi's ordeal was marked by severe physical and mental anguish. Are the 3 technicians entirely responsible for the accident? Not entirely. The Tokemura plant had strict production procedures, with automated processes monitored by technicians. However, JCO forced technicians to manually mix uranyl nitrate in stainless steel containers instead of using mechanical stirring, a highly illegal practice. Although such an accident had never occurred before, it went undetected or unpunished. Another factor was the lack of specialized training for technicians, meaning anyone present had to take responsibility for completing the job. Additionally, Ouchi and his colleagues used a higher concentration of uranium than before, initiating a self-sustaining nuclear chain reaction in the fuel storage tank, leading to a gamma and neutron radiation explosion. Thus, Ouchi was exposed to a large amount of radiation as he leaned over the tank to help Shinohara. Therefore, Hisashi Ouchi's tragic fate, as the individual with the highest recorded radiation exposure, illustrates the serious consequences of cutting corners in procedures and lacking training in the nuclear industry. What we've learned from this horrific accident is a clear warning about the need for adherence to safety procedures and proper professional training in the nuclear industry. Let's continue to follow the next parts of this series to explore more mysteries and deep insights into the world around us.